Welcome to the Exam Room Podcast, brought to you by the Physicians Committee. Hi, I'm the weight loss champion, Chuck Carroll. Thanks so very much for watching and downloading in more than 150 countries around the world and making the Exam Room one of the most consumed nutrition podcasts anywhere on the planet today. And we are at the International Conference on Nutrition and Medicine. My guest today is a first-timer. We've done 600 episodes almost, and I can't believe Dr. Thomas Campbell has not joined us until today. He is the founder and co-director of the University of Rochester Nutrition and Medicine Research Center, also an assistant professor of family medicine at the University of Rochester School of Medicine and Dentistry. With that, thanks for being here, Dr. Campbell.
Thanks. It's a pleasure.
Man, the Campbell name is just synonymous with health, and I feel like it's now been passed down to the next generation. Before we get going into the topic du jour, I'm just curious, do you feel any pressure, with your dad being who your dad is?
I don't feel pressure. I mean, he's always been open with whatever I want to do. It's more just a profound influence. I mean, I was in my early-ish 20s when I started working on writing the China study with him, and I spent 3 years co-authoring that book with him, and it just totally changed my life. People come up and sometimes say, "I read the China study and it changed my life," and really I could say the same to them. I worked on the China study and it changed my life. And from there, I went into medicine because of a passion, not because of pressure or anything, from family or my dad. So it's really low key. There's no pressure. If there's any pressure, it's to just lead a good life and have worth and value and that type of stuff.
Yeah. I think you're doing okay for yourself. I think you're doing okay. So having been so involved in that study and then getting into medicine, like as you're going through and starting your career, I mean, how much of your viewpoints, how did they differ from those of the majority of your colleagues in the medical field?
Yeah, I mean, it's an ongoing discrepancy, right? I mean, it's I have stories of I remember keenly in medical school when we had a small group discussion about diet and heart disease, and just these really aggravating conversations where sometimes people just scoffed at the idea or joked at the idea that diet even really could treat heart disease or let alone reverse it, And this was late 2000s. This was almost 20 years after Esselstyn and Ornish published some of their landmark work. And so, a lot of the information I've been exposed to in nutrition and health is simply not really commonly known in medicine and or in research for that matter. And so that discrepancy continues to be a big barrier to talking about this, implementing it, and doing that sort of work is just the lack of knowledge. So I've come across it a lot of different ways. I'd like to say it's starting to change. Yeah. Although that's purely sort of a personal exposure kind of thing, anecdotal.
Yeah. I feel like it's easy for us to kind of look through rose-colored glasses and say things are starting to change because this is kind of the world that we've immersed ourselves into. But then, recently I was just telling this story. I had a family member who wound up in the hospital for heart issues. And what are they serving him? But, sausage and eggs and pancakes loaded with butter. And as I said before, it's like if a person is there and they're served that, they're automatically going to think that this is health food. Right. That's a huge barrier. That's one of the barriers that we're talking about here.
Yes. Yeah. I mean, there are enormous moneyed interests, right, who have cultivated enormous efforts with very smart people and lots of resources to creating our food environment, to creating our information environment. And our food environment and information environment is oftentimes at odds with some of this research that I've been trying to communicate to the public, starting with working with my dad and on.
What do you think the key is to getting somebody to kind of let down their guard, forget about a line that's been drawn in the sand and you got to be on this side or that side when it comes to nutrition, and actually getting them to just listen to what the evidence suggests?
Well, I'm a little cautious about, I have to say, and I think my thinking has changed a little bit. I think when I first started working with patients, and now I've been at this quite a long time, I thought that if you could just present people with information, get them to sit down and listen to the information, that was the most important first step. And oftentimes it doesn't cut it. It's not the most important step. And so now I think if people are not open to it or willing to go there, I don't think there's that much benefit to banging them over the head with information. That there's something else going on, a reluctance of behavior change. There's other behavioral change factors that it's merely hitting them over the head with some information isn't going to address. Right. So if people are open and interested in having that conversation, we can sit down and talk about some key ideas. But otherwise, if they're closed and not open, I'm not one to try to badger them. I've found that it simply is not very effective.
I found that one of the times that people are most receptive to new information is when they're feeling at their worst or they're at the hospital. And sometimes that goes beyond just the patient themselves. It goes to their family members. And I know that one of the case studies that you're talking about here at the conference is one instance like that, where I believe a middle-aged woman came to you because she was extremely worried about her risk of breast cancer, which I believe her sister had been diagnosed with. Am I correct there?
Yeah, I mean, that's actually a fictional case. But
oh, well, forgive me, sir. Forgive me.
But that could be any number of people, right? I mean, so many of our patients, the vast majority of our patients, are afflicted with nutrition-related problems, and there are occasionally some people who come and say, I realize that nutrition is a big part of this picture. What do I do?
Right.
And it's not. Unfortunately, that's a minority of patients. But it's enough patients now and then that that come through that are interested in that message.
Yeah. Okay. All right. So let's say, does this woman have a name? Do we want to give her a name? She's fictitious, so we can pull one out of thin air. We'll call her Judy.
Yeah.
All right. So Judy is a 58-year-old female patient with well-controlled diabetes, hyperlipidemia, obesity, and worsening knee osteoarthritis. Sister recently diagnosed with breast cancer. So let's say that Judy is eating the standard American diet, and hopefully we can kind of put a graph like this up as we post this interview on YouTube. You do a great job of laying out the dietary spectrum that talks about, whether or not somebody's eating more animal products or more plant-based. And then beyond that, how much of that diet is a whole food diet versus how much is ultra processed. And what stands out to me is the standard American diet, which yes, and does include some plants, but definitely seems to be more on the animal half of things. But then when you want to talk about processing, it's through the roof.
Correct.
Detrimental to our health or not, sir?
Oh yeah, absolutely. I mean, every part of that equation is terrible, right? I mean, the most common plants consumed in American diets is probably white flour and sugar. And then you've got it filled in around that as a ton of meat and cheese and oil, and added oils. And there you have the American diet. So it's absolutely destructive to our health. I was if you indulge me a brief little story, if not too tangential, I was at Hershey Park recently with my family, took the kids to the amusement park. For the first time in my life, instead of pigeons eating the food that was discarded around the cafe food places, I saw a group of Canadian geese, which I thought was rather odd. But a Canadian geese had settled in at Hershey Park and was eating French fries, and they looked sickly.
Oh, wow.
They did. Their feathers were kind of dirty. They look a little bit disheveled. They did not look like the Canadian geese that I have in my backyard, and see all the time eating grass.
Right.
And it's just so striking. It's like, well, you're eating that food, goose. Of course, that's going to happen to you, that you're going to look kind of sickly. What do you think happens with humans? That we're eating exactly the same food? What happens? So that standard mixture of white flour, white sugar, oil, meat and cheese,
right,
in the American diet is absolutely wrecking havoc with our health.
Right. Well, specific to that's an interesting observation about the geese. That is really interesting. And by the way, does the park just completely still smell of chocolate? I haven't been in many years.
Yeah. Well, didn't notice the smell of chocolate so much, especially in the park because they had like French fries and stuff all over.
Gotcha. So, right. Okay. That's an interesting observation. I think that by and large, with the standard American diet being what it is, it's almost normal for a person to look sickly these days. Like, and we have blinders onto it because so many people look that way.
Yeah. When of the years I've done with trying to help people be healthier, and I think about the barriers to change, I think, and we don't talk about this all that much, but I think the number one barrier to change is social norms. And we have gotten to a point where it's socially normal to be unhealthy and unfit, diagnosed with a variety of metabolic problems. It's socially normal to treat that purely with medication. And it's socially normal to continue eating very, very unhealthy food. And so you have someone in that situation. We are very social creatures. And you have someone who's been, those norms have been entrenched and getting worse for the past several generations. And you have someone who says, wait a minute, this can't be right. And they might have one point of contact, and that's, someone, a crazy doctor like me or something, telling them to change everything they're doing in this key part of their life. And they look around and they say, wait a minute, this is totally different from everything. This is totally different from what my family does, what my mom told me, what my friends do, what other doctors tell me in terms of treating this. And those social norms just make it so hard to be open to a different way of doing things. And I think those social norms are absolutely critical. And I think when you start realizing how critical they are and you start noticing, for example, messaging around food and health, some of the doubt about, there's a book called Merchants of Doubt about the tobacco industry and how industry sort of fostered doubt about tobacco messaging. And you see the same thing with food, where, we could have clear, consistent messaging, but there's narratives that come in all over the place about uncertainties, doubt, this type of thing. And so it makes it very hard for someone who's challenging their own social norms to really trust that they should challenge those.
And that kind of opens up a whole other can of worms because a lot of the messaging, it's very slick. And there was recently the healthy at any size movement or healthy at every size movement. And there was a big expose in one of the major newspapers that showed that this was completely industry funded, where the majority of it was industry funded. And there were these dietitians who were super popular on social media who were taking big money from big food companies.
I'm not aware of that at all. That's really fascinating.
I will send that to you.
I absolutely believe it. I think if you look, for example, in social media, for example, people think that there's an independence to social media, but I see an environment that's the most easily manipulated environment of all information in terms of food companies and corporate interests in terms of putting certain narratives out there.
Yeah.
But it really is treacherous to try to navigate that messaging for an average person.
And it's also tough for people to accept because you never want anybody, regardless of how they look like, to feel bad about themselves. I think that that's detrimental ultimately to regaining your health. Because if you're feeling bad about yourself, like, what are you going to do? You're going to turn to comfort food. You're going to turn to the things that are going to make you feel better, at least temporarily.
Yes.
The French fries, like the geese we're eating.
Yes, that's always the flip side and an important point when you're talking about how important our our food choices are. Is to realize this is not about blame. We didn't get into this situation because we're bad, because we're making, we're bad people. It's not about blame or fault. It's about climbing out and finding something better.
Absolutely. It's a tough thing. I will send that to you. I'll be real curious to get your thoughts on it. It is fascinating. And it goes back to what you were talking about, the tobacco companies and their messaging. And for a long while, the tobacco companies shifted over into the food industry.
Yeah. They still do, I believe.
Yeah. And so that's why the messaging is so similar. Think back to the 1950s and the cigarette ads, more doctors smoke Camel than any other cigarette.
It was very effective.
Yeah.
Yeah, very effective.
Yeah. So Camels must be healthy, right?
Yeah.
Come on. Let's talk about some of the research and things that you've seen up your way at the University of Rochester. I mean, right here, you were talking a lot about diabetes and the effectiveness that a plant-based diet can have in diabetes. And I recently saw a statistic where globally, I believe by the year 2045, close to 800 million people are going to have some form of diabetes. That is a huge number.
Yeah, it's not only hugely prevalent, but hugely expensive. I mean, you're talking about something with not only the tragic personal cost of diabetes outcomes, amputations, kidney loss, death, et cetera. It's enormous implications for society in terms of the cost of this disease. And there's stats after stats. 1 out of 5 days in the hospital, 1 out of 5 hospital days is due to diabetes. The average diabetic incurs about almost $20,000 of medical costs a year. The majority of that coming directly as a response, due to their diabetes. The diagnosis of diabetes. So yeah, it's a big deal. And if you look at the literature, so in my clinical practice, I had consistently seen people with pretty advanced diabetes who were on daily insulin, so they're insulin treated. And they were taking daily insulin, what we call basal, a 1 shot a day dose plus prandial insulin. So they were taking an insulin shot with every time they ate. So, 4 shots a day. And I've seen a number of patients like that and a number who have gone on to substantially change their diet. They're one of these fairly rare people that is just extraordinarily motivated. I give them a food guide, talk through the whole long visit. And they go home and they do it, 100%. And I've seen these situations where they have just remarkable, transformative, and rapid responses, and including reducing their insulin dose very quickly because their blood sugar drops so quickly. And I use a whole food plant-based diet. There's no animal products, no added fats, minimal added sugars, everything whole grain, et cetera. If you look at the scientific literature, there's not a lot of research looking at people with more advanced disease. A lot of dietary interventions have either excluded people with more advanced diabetes or insulin-treated diabetes, or they simply just don't describe them because most of their study population wasn't taking insulin. So you can't find a lot of information. So we did a study to look at, to better characterize dietary acute response to significant dietary change. And we used, so it was a small study, but highly involved with a lot of touch points. And we used a DASH diet. So we took people on a standard, whatever their baseline diet was. We observed them for a week. We did testing. Then we switched them to a DASH diet. DASH diet is sort of a healthy American diet. There's no, if you want to, I know people laugh at that idea, but there is a healthier American diet. Focus on lean meat, less fatty meats, less processed meats, a lot more fruits and vegetables, a lot more whole grains, lower in fat, and an emphasis too on some low-fat dairy. We used a DASH diet for a week and then repeated all our testing, and we put them on a whole food plant-based diet, totally. It was a vegan, no animal products, but no added pure fats, no oils, no added solid fats, minimal sugars. They could eat as much as they wanted through the entire dietary interventions. They could eat as often as they wanted to be full. In fact, we consistently told them, you might have to eat more. Go ahead and eat as much as you want to. And
I'm sure that was well received, wasn't it?
yeah. But importantly, we wanted to check. We wanted to see what the effect of these diets was when they're done well. So we, as part of our research center, we have a commercial kitchen. We have a full-time chef. So nice. We provided them with about 1,800 calories a day of prepared meals and snacks. But they could eat more. They could add their own food in place of or in supplement to our meals. And what we found is, if it's sort of jumping to the punchline, is that after a week of DASH and after a week of whole food plant-based, after just 2 weeks, their insulin requirements were down about 40%. Their blood sugar was down about 20 to 25% average blood sugar. A whole host of things got better. Inflammation, cholesterol, other hormones, leptin, insulin resistance, everything got dramatically better quite quickly.
What was the fat content like between the two diets? If the baseline was 1,800 calories, were there discrepancies in the amount of fat?
Yeah, there was. So DASH is lower fat than it's sort of a healthier version of an American diet. So it's lower fat, but it's still fairly moderate. And I don't want to get the numbers exactly, I don't recall the exact table, but it's somewhere around, I think, 30%, maybe slightly less of calories from fat. So it's definitely lower fat. A little bit less added fats, less fatty meats, like I said before, no
Sure.
fried foods, that
Sure.
type of thing. So definitely lower fat.
And those who then went on the whole food plant-based diet, that fat drops even further.
Even further, yeah. So
Right.
what we saw, because of our study design had some important limitations. We didn't have a washout period between these diets. And so there was some carryover effects of these two diets from dietary period to dietary period. And that limits our ability to compare these diets, the DASH and whole food plant-based, in a quantitative way. So we can't say whole food plant-based resulted in a 25% better outcome or whatever like that. But we can get a sense of qualitative differences. So they went on a DASH diet, a whole food plant-based diet, and then back out to a DASH diet.
Okay.
And what that basically translates into is going from a standard American diet to moderately healthy changes, to strictly healthy changes, back out to moderate changes, and then through that whole process, seeing how their blood sugar and insulin requirements change. So it's kind of going, from terrible down to less terrible to good, back to less terrible.
Gotcha.
And so qualitatively, we saw that the DASH diet was better than the baseline, but not as good as the whole food plant-based, because after they finished the whole food plant-based and went back on DASH, everything started to get a little worse again.
How quickly, you said that the changes happened pretty rapidly. How quickly were you able to see the changes once they did shift over to the whole food plant-based diet?
So it's hard to say beyond,
because there was that crossover, right?
Because the crossover and it's and there was a process, but at the beginning of each dietary phase, because we anticipated people making such big dietary changes, we were giving them their food. We actually cut their insulin dosage down by 20%.
Wow.
Even before they started.
Okay.
And then we usually or often had to cut it down even further within the few days. We contacted these people every single day to check on their blood sugars and adjust their insulin to keep them safe so they didn't have low blood sugar.
What was the feedback you got in terms of the dietary changes? Because by the time they get to whole food plant-based, that's a big difference from that standard American diet.
Yeah, it varied, but one commonality was that, people had they had been in the medical system. These were people with they all came from a specialty clinic. So they had moved beyond primary care. Their disease was advanced enough. They all had a specialist managing it. And the commonality was that they oftentimes had never heard that they could eat this kind of way and get their diabetes under better control. I mean, we told them go ahead and have sweet potatoes and beans and whole grain products and even some whole grain pasta, add that in, And so these are, with the whole food plant-based, we significantly increased their carbohydrate intake.
Right.
And these were people who on average were on over 90 units of insulin a day, had been, in the diabetes medical system, education system for years and years and years. And they hadn't really heard that they could approach it with this high carbohydrate diet.
Well, let's talk about the different way that the body reacts to these carbs that come from something like a sweet potato versus the carbs that come from that white flour that's so prevalent in the standard American diet. I would imagine it gets processed very differently.
Yeah, and I think it's it would be. I think it's the whole package of the food, right? It's not just the difference in carbohydrate quality and stuff. It's the package it's in. So if you're consuming a huge amount of fiber and low fat and, as a whole food, as opposed to a white flour or processed white sugar, that's quite a different nutritional experience.
Yeah.
So if you wanted to simplify it, you could certainly say there are sort of good carbohydrates and bad carbohydrates. There absolutely are problems with most of the carbohydrates that Americans eat because they're eating white flour and sugar. So,
Yeah.
You limit those and take those out, things get better.
I'm looking at a breakdown of the various diets and the fat, protein, and carbohydrate breakdown of the two. What really jumps out at me is, again, we just talked about the lower fat in the whole food plant-based diet. But then you look at the protein content, though, for a whole food plant-based diet, while it's still getting an adequate amount, is far less compared to the DASH diet and the baseline diet.
Yeah, DASH, interestingly, and I didn't, it kind of escaped me, I think, when we were planning this study, but the DASH diet actually ends up being a high protein diet. And we drew our menus up and followed it, exactly sort of as intended. If you look at the guidelines, and because of its emphasis on low fat dairy, low fat cheese, low fat milk, and yogurt, all those foods are high in protein. So if you're snacking on a high protein thing, every single day, the DASH diet ended up being a high protein diet. So there's a couple of challenges from our study from the conventional model. I've heard people with diabetes, absolutely every single one is focused on carbohydrates. It's always a conversation, where I say, I know I sound crazy, but just trust me. And if you're on insulin, you'll be able to know whether I'm right or wrong within a week. Go ahead and eat these carbohydrates, and you'll know if I'm crazy and wrong within a week. It's not that big of not that terrible of an experiment. But the other misconception out there, I think, in misconception, it's complicated, but the other common conception is that protein is like the savior.
Right.
I've got to have a high protein breakfast. It's going to help my blood sugar. It's going to keep me full. I've got to have a high protein lunch, et cetera, protein supplements, and people oftentimes equate protein intake somehow with blood sugar control as well. And it turns out that, our study challenged both. We saw people get sort of qualitatively, they had better responses with a high carbohydrate intake and a lower protein intake.
Correct me if I'm wrong. Some high protein diets, not necessarily DASH, but say the keto, which really focuses a lot on fatty types of meats, that can be exceedingly detrimental to a person's diabetes because of what's known as, and I got schooled on this, intramyocellular lipid, right? The insulin literally can't get into.
Well, it's complicated. And I'll say something that, the plant-based community may not be super keen to hear based on your bias, but there's now quite a bit of literature showing actually some benefits to a keto diet and blood sugar control. So if you put someone on ketogenic diet, they're pretty universally across now many interventions, their blood sugar gets better.
Okay.
And their insulin requirements go down, similar to what we found actually. So, but here's the thing, here's the difference is that, and this is a very simplistic way to look at it. I'm sure there's experts out there that could poke holes in this, but the very simplistic kind of analogy that I use with patients is that if you have diabetes, it's like imagine you have a problem with your sink in your bathroom, and you turn on the sink, the water doesn't go down because there's a clog in the pipe just in the trap underneath the sink, and so the water's overflowing. And there's two approaches to fixing that overflowing water, that overflowing blood glucose in your system. One is to simply walk over to the sink and turn off the water. And that is the keto approach. You have basically no dietary carbohydrates coming in. So you're just turning off the main supply of any blood sugar.
Right.
And things absolutely do get better in these studies, as long as people are adherent. Their blood sugar comes down, insulin comes down, they lose weight, et cetera. But I'm interested in fixing the clog under the sink, because that's the genesis and the problem of this. And I do believe, based on the research, that intramyocellular lipids and some of that, what you mentioned, and some of the pathogenesis of insulin resistance, I think really a plant-based diet gets, instead of just turning off the water, it starts to unclog that blockage under the sink. I don't know if that analogy makes sense.
No, it absolutely
too complicated.
does. It absolutely
but
does.
It's two ways to go about the same problem of seeing reduced blood sugar.
Right.
And so and for a number of reasons, I prefer the plant-based approach.
Absolutely. That's interesting because that was going to be like my next question to you. Is it because they're just eating less sugar overall with that particular diet? And
yes,
so that's a big yes.
Yes, absolutely. So that, you know, we do get our blood sugar from eating carbohydrates, you know,
Sure.
largely.
Sure.
So if we deplete our carbohydrate stores and we don't consume carbohydrates, we're going to lower our blood sugar.
All right. Well, I wish that we had more time. We kind of have to leave it there, but this has been fascinating. I love it when new research is presented here, and thank you for stepping up and bringing that to the plate. That was a great analogy. Thank you, my friend.
It's my pleasure.